So today we are going to start our second topic, that is about the cell injury. So let's first try to understand what is the definition of cell injury. So here I am taking one example of one cell, and on this cell I am putting a stress. It is any kind of stress. So when you are putting a stress on any kind of cell, that cell will undergo certain kind of growth adaptations. Like if you are putting a stress on the cell, that cell can increase its size, which is called hypertrophy. That cell can increase its number of cells, that is called hyperplasia. But what will happen if this stress is continuously increasing? And what happens when this stress exceeds the cell ability to adapt? Then the cell will become injured. So please keep in mind, cellular injury occurs only when the stress exceeds the cell ability to adapt. If the cell has the ability to adapt, it will not undergo cellular injury. So this is the basic definition you guys have to keep in mind. Then you have to keep in mind that the hallmark, the injury of the cell depends on the type of stress. The injury of the cell also depends on the severity, and also it depends on the type of cell. So if the question comes and it asks from you, like the injury of the cell depends how many factors, it's depend on the type of stress, it depends on the severity of stress. Then third, it depends on the type of cell, like on which type of cell you are going to putting a stress. So let's suppose, let's take an example. As you guys knows, the neurons are highly susceptible to ischemic injury, while skeletal muscle is more relatively resistant. So it's mean, if you are talking about the neurons become injured very easily because of ischemia. But if you take and compare that with skeleton muscle is little bit resistant. So it's mean cellular, if the cell is going to be injured, it's depend on the different factors, like what kind of stress you are applying on that, what is the severity of stress, and it also depends on the type of stress. So please keep this difference in mind. Then also it's very important, you guys have to understand what are the causes of cellular injury. On your first aid they didn't mention the causes of cellular injury, they directly mention the types of cellular injury, but we will go step by step. First of all, you guys have to understand a definition. What is cellular injury? Cellular injury occur when the stress exceeds the cell ability to adapt. Then you have to keep in mind the how many type of factors on which cellular injury depends. It depends on the type of stress, it depends on the severity of stress, it depends on the type of cell on which you are putting a stress. Then after that, you have to keep in mind what are the causes of cellular injury. Then third thing is causes of cellular injury. So what are the causes of cellular injury? First one is the inflammation. This is the first cause of cellular injury. If a inflammation occur in your body, it can injure yourself. Then second, we have the nutritional deficiency. Nutritional deficiency can also cause cellular injury. Then also, if there is any kind of hypoxia can also cause cellular injury. Then if there is any kind of genetic mutation in your body, so genetic mutation can also cause the cellular injury. So these are the common causes of cellular injury, which includes the inflammation, which include the nutritional deficiency, which include the hypoxia, which include the genetic mutation, and fifth, trauma. So these are the common causes of cellular injury. So that's all about the causes. Now let's talk about the types of cellular injury. So basically we have two types of cellular injury. One is the reversible and second one is the irreversible. First of all, trying to understand the concept. What is the difference between a reversible and irreversible? So let's take an example of one cell. This is an example of one cell, and I am putting a stress on this cell. And let's suppose I put a stress on this cell and this cell become injured. But after a few, you can say after a few minutes or after injuring the cell, I remove the dead stress. If you remove that stress, the cell will become return to its original shape or original condition. So that's why cellular injury is reversible. Mean if you remove the stress, the cell will return back to its normal condition. But what is the meaning of irreversible? Irreversible mean if the cell become injured one time, even if you remove the stress, it will not return to its normal condition or normal position. So this is a basic difference between irreversible and irreversible. So please keep this in mind. Now let's talk about first what will happen in the reversible cell injury. So here they mention when the cell is reversibly injured, there is decreased production of ATP. So let's take an example of when the ATP is decreased in our body. So it's very easy. You guys know that in the electron transport chain in our body, there is an electron transport chain which help in ATP production. And electron transport chain is dependent on oxidative phosphorylation. If the oxygen is present in your body, that oxygen work as a final electron acceptor in the electron transport chain and it will produce the ATP. So let's suppose if the person has less oxygen in the body, if the person has less oxygen in the body, like you can say if the person is having less oxygen in the body, then if the oxygen is less, then that oxygen will not go to the electron transport chain because oxygen is deficient in the body. So when the electron transport chain will not work, the ATP will not produce. So that's why they say in the reversible cell injury, how ATP can be reduced. Its one reason can be hypoxia. When there is decreased amount of oxygen in your body, less oxygen will go for the electron transport chain. When the less oxygen will go, there is decreased amount of ATP production. And when there is decreased amount of ATP in your cells, there are sodium potassium ATPase pumps and the calcium channels are the calcium pumps. Because these pumps are the ATP dependent, if the ATP is present in your body, these pumps will work. So when there is less ATP, the calcium channel and the sodium potassium pump will not work. So let's take an example. This is the cell, and you have to keep this thing in mind. In every cell of our body, there is a one transporter which help to throw sodium from inside to outside and potassium from outside to inside. And this pump is sodium potassium ATPase, and this pump is dependent on ATP. So let's suppose if there is less production of ATP. So if there is no ATP, this pump will not work. When this pump will not work, sodium will stay inside the cell. When sodium will stay inside the cell, it will suck the water because the intracellular sodium concentration will increase. And when the intracellular sodium concentration will increase, it will draw the water towards inside. It will lead to cellular swelling. So how the cellular swelling occur? It is mainly because of failure of sodium potassium ATPase pump. When this pump will become fail, the sodium will not go from inside to outside. Sodium will stay inside. The intracellular concentration of sodium will increase. It will lead to cellular swelling. It will lead to the cytosol. It will lead to mitochondria, endoplasmic reticulum. All things are going to be swell. You have to keep this in mind. And this is the earliest morphological manifestation of reversible injury. And if the question comes in the exam, like what is the early morphological change in the reversible cell injury? Please pick the cellular swelling. And if they ask what is the mechanism behind this swelling, pick the sodium potassium ATPase pump failure. So this is the first thing which will happen when the reversible cell injury start. Then second, there is the detachment of the ribosome and the polysomal detachment. We know that if the ribosomes are not going to be attached, then there is no protein synthesis because we know that the ribosome, if the ribosome will go and attach, it will help to produce the protein. But when the ribosomes are going to be detached, the protein synthesis will also decrease. So please keep this thing in also mind. So this is the first thing you guys have to keep in mind. And second thing, the plasma membrane changes. It will lead to the blabbing. We will also check this diagram. You can see below that this is the normal cell, and after the reversible injury, the cell membrane has these pockets. These pockets are called blebs. So this is the plasma membrane change which will occur after the reversible cell injury start. Then after that, there are the nuclear changes. Nuclear changes mean the chromatin material will clump together, which is called chromatin clumping. Then after that, there is a rapid loss of function. So you guys can take an example. Let's suppose we take the example of myocardial cell. We know that myocardial cell, our main function is to contract and push the blood from ventricle to aorta. And to to contract the ventricle, we need ATP. So when there is less ATP, the myocardial cells are non-contractile after the 1 to 2 minutes of ischemia. Because when there is ischemia, there is less oxygen. When there is less oxygen, there is less ATP. When there is less ATP, the myocardial cells are not going to be contracted. So that's why they say it will lead to rapid loss of function. Then after that, there is formation of myelin figure. So what is myelin figure? Basically, it is the oxidized form of lipid. When the oxidized lipid is accumulated, aggregated, those peroxidized lipids are collectively called myelin figure, and it is the hallmark of reversible cell injury. So you guys have to keep all these things in mind. So if the question comes in exam, like the initial phase of injury is reversible, what are the hallmark of reversible injury in a cell? So first one is the cellular swelling, the cytosol swelling. Then also there is a formation of membrane clubbing. There is a loss of microvilli. You can also add here one important point, loss of reversible cell injury. Then the swelling of rough endoplasmic reticulum occur. If the rough endoplasmic reticulum will swell, it will detach from the ribosome. If the ribosome is going to be detached from the rough endoplasmic reticulum, there is decreased amount of protein synthesis. So if they ask from you in the reversible cell injury, why protein synthesis is decreased, simply you can pick the option which says the swelling of the rough endoplasmic reticulum lead to the detachment of ribosome. When the ribosomes are detached from the endoplasmic reticulum, there is decreased amount of protein synthesis. You have to keep this thing in mind. So these are basically the changes in the reversible cell injury. After that, let's suppose if you will not remove the stress, and the cell will become like irreversible cell injured. Then if the cell is irreversibly injured, you have to keep one thing in mind. Now you cannot move the cell to its normal position even if you remove the stress. So next we will study what are the hallmark or what are the changes that occur in the irreversible cell injury. First of all, the plasma membrane will break down. When the plasma membrane will break down, the intracellular enzymes will leak out. The cytosolic enzymes will leak out from outside, from inside to outside of cell. And also when the plasma membrane will become damaged, it will break down. The calcium from outside to the calcium will go from outside to inside. So let's take an example of one cell. In the reversible cell injury, the plasma membrane is damaged, the plasma membrane is breakdown. So two things will happen. First of all, the intracellular component, the intracellular enzymes will come from inside to outside. So intracellular enzymes are going toward the outside, and from outside calcium is more, that calcium will go inside the cell. You have to keep these things in mind. When the calcium will go from outside to inside, this calcium will go and activate the degradation enzymes, and these degradation enzyme will further damage your cell. So this is the first thing which will happen in irreversible cell injury. And after that, the mitochondria damage will occur, mitochondrial dysfunction will occur, and we know that our electron transport chain is working in mitochondria. If the mitochondria will become damaged or dysfunction, there is a loss of electron transport chain, and when the electron transport chain is lost, there is less amount of ATP. Then after that, when the cell become injured, the lysosomes will also become ruptured, and it lead to autolysis. It will lead to auto destruction of your cell. Then after that, the nuclear degradation occur, and as I already explained in the previous lecture, there are certain processes in which the nucleus is undergoing degradation. First of all, the nucleus will become condensed. Let's suppose this is the nucleus. So first change will occur in the nucleus, it will condense. This condensation process is called pycnosis. After that, this will break down into fragments. This is called karyoexesis. And after that, these fragments are dissolved, which is called karyolysis. So nuclear degradation occur in three steps. First of all, the nucleus will condense, which is called pycnosis. After that, the nucleus is going to break down into fragments, which is called karyoexis. And third thing, the nucleus is going to be dissolved. The nuclear component is are going to be dissolved, which is called karyolysis. So these are the three steps through which the nuclear degradation occur. Then after that, there is the accumulation of amorphous densities or inclusions in the mitochondria. Basically, these are the cytoskeleton structures of the cell, which will accumulate or which will form in the cell as they become accumulated in the mitochondria. These are called amorphous densities. So what are amorphous densities? These are the cellular components, and these components are formed after the cell is irreversible injured. So this is the like topic of cellular injury. Now let's try to understand this diagram. So first of all, this is the normal cell. You can see this is the normal cell. Plasma membrane is normal. Rough endoplasmic reticulum is normal. Everything in the cell is normal. So let's suppose now you are putting a stress on this cell, and this cell is going to be injured, but that injury is reversible. In the reversible injury, you can see first of all the plasma membrane is ओके ऊपर करना है थोड़ा कहिएगा जरा अब ठीक है Okay, so let's try to understand this diagram. First of all, this is the normal cell. Now you can compare the normal cell with the with the reversible cell injured. So first of all, you can see there is a formation of these pockets in the plasma membrane. These pockets are called membrane blubbing. This is the membrane blubbing. After that, you can see these are the ribosomes. The ribosomes are going to be detached from the endoplasmic reticulum. But in this diagram, you can see this is the endoplasmic reticulum, but the ribosomes are attached with the rough endoplasmic reticulum. But the when the cell injury occurred, these ribosomes detached from the endoplasmic reticulum. When the ribosome detached from the endoplasmic reticulum, the protein synthesis is decreased. This is the second step. Then after that, you can see here the mitochondria size, but here the mitochondria is swelled. Then after that, you can see here there is a chromatin material, but here you can see the chromatin material is clumped. So these are the changes which you have to keep in mind, and these changes occurred in these changes occurred in reversible. And after that, if the stress is so severe, the cell will become irreversible injured, and irreversible injured, you can see the plasma membrane will damage. When the plasma membrane will damage, the intracellular enzymes will come outside. And after that, the lysosomes will also rupture. When the lysosome will rupture, it will lead to autolysis. Autolysis means destruction of cell by its own. So this is the example of autolysis. Then after that, mitochondrial permeability will increase. Then the nucleus become degrade, and the nucleus is degraded through three processes: pycnosis, karyoexis, and karyolysis. So this is the topic of cellular injury.